finally in. Good afternoon
Yes,
to
you
you. How
are.
are you
Yes,
doing
you are.
today?
I'm solid. Can you hear me, madam?
Yes, I can. Yes, I can.
Okay, I'm great. I'm elated to be having this conversation with you. You are most welcome, madam.
Thank you.
How you doing today, madam?
I'm doing just great. Thank you. I have a flu, but I'm better. I'm trusting that you're able
Oh,
to hear me, and then our own audience would hear me too.
yes, we can. Yes, we can hear you. Thank you for joining this
You're welcome.
amazing conversation that we're about to have. Indeed, I see that the weather is having a toll on all of us. It's that time of the year. If you live in
Yes.
Nigeria. So, yes, we apologize for whatever constraints that might be, but also we appreciate and we celebrate you for being part of this, even irrespective of whatever condition that you might be feeling at the moment. But
That's
Peace,
great.
it's my absolute
Yes.
pleasure to have you here. My name is Epic. I'll be hosting this conversation. And before we go any further, allow me to officially ask, shall we begin, madam?
Yes, we shall.
Absolutely, absolutely. So, ladies and gentlemen, as I have said earlier, it is the Lend Your Voice 1000 Voices for Autism series, proudly brought to you by EK Foundation for Autism. Today's conversation is understanding and managing neurodivergent disorders, and I will not be doing this all by myself. As you can see, the final face to the right or the left of your screen is the amazing Mrs. Peace Festus, who is an ABA analyst. Ladies and gentlemen, wherever you are, drum rolls or give a resounding round of applause as she takes the stage to give a quick introduction of herself. Madam Peace, you're most welcome.
Thank you. Good afternoon, everyone. Thank you so much, Epic, for having me. That's a nice name you've got there.
Right?
Anyways,
We
yes.
try to live up to it.
Yeah. So, like he has said, my name is Peace Festus. I am an international behavior analyst, a qualified autism specialist, and a supervisor. I am the founder and program director of Produce Care Lagos. Produce Care Lagos is a mobile therapy provider, and we provide services cut across ABAs, speech therapy, occupational therapy, as the need where I really, really love working with children generally. I also love working with children with different neurodevelopmental disorders like autism, Down syndrome, ADHD, whatever the case may be. I'm very passionate at what I do. I'm also a trained teacher, as it were. Yes, so that's pretty much about me. Yes,
I
thank
mean,
you.
that's a quite extensive introduction. It's amazing that I'm always honored whenever we have these conversations because I want our guests to understand the importance of having people of this magnitude that we bring here. It's not beans. It's not an easy thing. It's not an easy fit to have people of your standards to join us, and we are super elated and honored to have you join us because
Yeah.
it's a clear evidence that you recognize the importance of these conversations in your own capacity. You are championing the cause for autism advocacy, and for that reason, we say a very very big thank you again for joining this. We'll get right straight into the conversation. We want, because we do not have all the time in the world, so we want to try our possible best to tap into as much of your knowledge as we can get, basically. Right? So yes, straight into the conversation. I want us to do something that helps people follow us extensively as we go. So first, let us start from the what I would consider the basic. What are neurodivergent disorders? I want you to give us an extensive introduction of what neurodivergent disorders are.
Okay. All right. So I would start by quickly explaining what neurodivergence is not. So we have neurodivergence, we have neurotypical. So the neurotypical individuals or neurotypical people are like yourself, Epic, and myself. So we tag them or we call them normal in quotes. So they are neurotypical, just like yourself, just like myself. And then we have the neurodivergence. We call them the neurodivergent because their brain is wired differently from the neurotypical. So the neurodivergents have their brains wired differently. And there are different types of neurodivergent disorders. The very popular one, like we all know, is autism. Okay, autism spectrum disorder. And then under the autism spectrum disorder, according to the DSM-5, we have the autistic disorder, we have the childhood disintegrative disorder, we have the Asperger, and we also have the pervasive, that's PDD-NOS. So that's about autism spectrum disorder. Neurodivergence, the term neurodivergence is beginning to get more popular. The layman, like you already know, is not so conversant with the term neurodivergent. So we try as much as possible to come down to the layman's level and break it down. And what I usually say to them is a difference in the brain. Basically, neurodivergence, there's a difference in the brain, the way the brain is wired in the aspect of communication. A neurodivergent individual might not communicate the way a neurotypical individual would. A neurodivergent individual might not see the world the way a neurotypical individual would. So they just have a difference in the brain. So whenever someone comes to me and says, what's neurodivergence? What does it even really mean? I just say it's a difference in the brain. Their brain is wired differently, and they see the world, they perceive the world differently, and that's why they have tendencies to behave differently from the typical or the normal. Yes.
That very brilliant way to start the conversation. I'm already super excited because you have charged me up with this very extensive definition you have given and still summarized with the very succinct way where you ended, where you said you like to sum it up with, instead of going into the nitty gritties and intricacies. If you're talking to a man, you like to sum it up with the fact that it's a difference in the brain, and it's a very extensive way to describe this. But now you have said it's a difference in the brain, right? On the way the brain operates and the way the brain is shaped, basically. Um, People might tend to ask, right? So, what's the difference between a neurodivergent disorder and mental illness, basically, or a psychiatric disorder and cognitive delay? How can we highlight, or what key factors should we look at to extensively highlight the differences between neurodivergent disorders and maybe mental illness, cognitive delay, and those other things that might that cause differentials in the brain?
Okay, so people I would always use autism because that's the core.
Yeah.
We work with children with autism mostly. So I would start by saying people usually think that autism is a mental disorder. It's not a mental disorder. It's a neurodevelopmental disorder. It has to do with the brain. It has everything to do with the brain and the individual not meeting their developmental milestone. So that's why it's called neurodevelopmental disorder. So about the brain, and the child is not meeting their developmental milestone. So let me give you an instance. Autism, for instance, the child is affected in three major ways. We have difference in communication, we have difference in social interaction, and lastly, difference in behavior. And the behavioral part of it is divided into two. We have the stereotypical and the repetitive, pattern of movements, and then the routine, right? Routine and interest. So this is me saying that autism is not anything that has to do with mental health, although an autistic individual might have issues in that regard, right? I mean, the psychologist would have a lot to say about that. My field is ABA, applied behavior analysis, right? So that's just it about that. So autism is not a mental disorder, right? They are not mad, in quotes, right? They just have a difference in the way they view the world or they perceive the world. It's about the brain. And as a matter of fact, there's a research I don't know if it was in the US now or in the UK, like you already know, research has it that autism is more prevalent in the boys than the girls, right? So
Yep. Yep.
there was this research, there was this experiment done, I think it was in the US, where they found out that the size of an autistic boy's brain is slightly bigger than that of the girls. Yes, so slightly
Wow.
bigger than that
Okay.
of the girls. Yes, all around, like all the boys, they have bigger brain than that of the girls. So this is me saying autism is nothing that has to do with mental illness or whatsoever. It's just purely neurodevelopmental. And what does it mean in a layman term? It means a difference in the brain, and then they are not meeting developmental milestones regarding communication, social interaction, and behavior.
I love the
I was
clarity that
able
it comes.
to,
I mean, we're barely about 15 minutes. Anybody who had or who did not have prior knowledge to this can articulately state and describe from what you have said extensively, or the using all the right terms in particular, can confidently say that they know a thing or two about neurodivergent disorders and autism in particular. I love how you have, because people try to infer, right? When they recognize a child on the spectrum or a person on the spectrum, tend to, especially with the way our society works, people tend to want to draw a parallel and say this is a mental condition or a mental kind of illness. And I like how you
Yeah.
have articulately, unequivocally stated that it is not. It's just it's just a different pattern of brain formation. I love how I recognize that I'm going to be schooled a lot in this conversation, and the fact that you already mentioned that the autistic boy's brain is that research that you addressed, I think I'm already taking notes, as you can see clearly. So
Excuse me.
in a society like ours in Nigeria, as you have said, one of the common misdiagnoses that we see is when people say that or want to attribute an the case of an autistic or a person living with autism as mental illness. But what are the common misconceptions that people have when it comes
Mm,
to people who live with autism? What are the common
mm,
in our society like Nigeria? There's so many common people like to say, the child will not grow up well. And these things are recurrent, especially when you are in
yes.
circles or in gatherings with people who are not well informed, right? I want us to get into that a little bit, address the common misconceptions and the better things to say with regards to people living with autism.
Yeah. Please, you need to pardon me.
Yeah, no,
Excuse me.
we totally do
Yes.
understand.
I might need to turn off the fan.
Yes, it's fine. Take your time. Smart Pace will be joining us in a minute. She just quickly needs to sort water. So, I mean, when we have guests, yeah, back.
Yes, I'm back. Apologies. So, speaking about misconceptions, there are a lot. And sometimes I would not lie. I peak, I cry. I'm not going to lie to you. Sometimes I cry, I shiver in so much, awe. How can someone say this to someone else? Awareness, like we always say, awareness has to be every day. When you're not aware about a particular concept, right? There is every tendency for you to say a whole lot of nonsense, right, regarding that. So when it comes to misconception, the first one I see every day, every time I step out of my house to go to work, is spiritual problem. This problem is spiritual. Oh, this problem is spiritual. You need to go to church. You have to go to church to pray. Something is happening from the coven of hellfire, or from the coven of the witches. Autism is not a spiritual problem. Now, there is a thin line between understanding this fact and knowing the place of God and faith. I'm a believer, and I believe that miracles happen and all of that. But really, autism is not, it's not a spiritual problem. Number two, another thing I would say again when it comes to misconception is some people feel like, now the spiritual aspect, and then they are doing you from your village. There's a link. Now, I'm using all of these terms because this is Nigeria. We
Yes,
see all
Nigeria.
of this. We see this happen a lot, yes, in Nigeria. Another thing about another misconception about autism is that autistic people cannot thrive, or autistic people are just going to be like, vegetables for the rest of their life. That's not true. I've worked directly with autistic individuals. I've worked indirectly, or yeah, with autistic individuals as well. And I've worked with children who had nothing in their repertoire per se, and we built from there. And they are doing so well. Do they still have challenges? Of course, a big yes. They have challenges. The diagnosis itself comes with challenges. We all know that. But can they still thrive? A big yes. Let me give you an instance. When it comes to this misconception about autistic individuals, how that they can't do well in life, they can never be independent, they are always just going to be, dependent for the rest of their life. I'll give you an instance. We have a child we work with. This boy can draw anything. He sees something, he puts it down, he draws it. What do we say about that? That's a potential to harness. And even if he doesn't end up going to the university or college, it's an area he can dive into. So autistic people are not vegetables. They have talents. They have their strength. Yes, they have their weaknesses, and this strength can be harnessed. Yes. So as we go on, I'll keep thinking about more misconceptions about autistic people. Yeah.
I mean, you have highlighted one very significant one, and I love the fact that you have not entirely debunked. But while highlighting that, you also emphasize the fact that you are a person, you're a believer, and you have the faith too. Coming from your own opinion, I'm sure that people listening will recognize that, as you have said, it's not a spiritual problem, right? Because that is a common misconception, especially in a society like ours. A lot of people tend to want to refer and say, there's something, there's magic somewhere, there's voodoo somewhere, there's somebody attacking you from a village. And I love how you have unequivocally stated that it's none of that. It's none of that. And people need to understand this too. We are warming up into the conversation, basically. Now we have unequivocally addressed what neurodivergent disorders are and how they may present themselves, significantly highlighting the differences between neurodivergent disorders and what might be termed as mental illness and cognitive delay and all of that. Let's get into a more practical part of the conversations. What are early signs for parents, caregivers, educationists, or educators rather, to take note? What are early signs that they can take note of and see before they can probably prompt or refer for diagnosis? What are early signs to notice in children? What are early signs for parents, caregivers to notice in children before they can see that this child might be neurodivergent? This child is a little bit different. It might. What are early signs for them to note to now infer that probably a diagnosis should be carried out on?
Beautiful. I really love the angle of your question. You said what are the signs? You said you did not say what are the signs to look out for to check for autism, right? You said the signs to ascertain if your child is neurodivergent or not. So yeah, that's a very beautiful question. The first thing I would say is when your child is not meeting their developmental milestone. That's the first thing you need to look out for. And people might say, or our audience might say, oh, what are even the developmental milestones? Oh, I don't even know the developmental milestones. Now, you might not know the developmental milestones. You might not know the signs out there, but you know what a typical child's development should look like. That might be your first child. I was having this conversation with I don't know now, maybe one of my colleagues, and my colleague said, she said, Peace, it's because you're in the field. That's why you're on the lookout. I have two beautiful children, by the way. I have a 21-year-old girl and a 7-month-old girl, and I am watching them. I am watching them. So this person said, oh, it's because you're in the field. That's why you know what to look out for. I said, no. fine, I'm in the field, and that's a plus, definitely. But even if you're not in the field, you might not know what to look out for regarding neurodivergent, but you know the right thing. You know the right thing your child should do at a particular time. Why? Because you see other children on the internet. Why? Because you see children in church. Why? Because you probably have a sibling who has children as well, right? So let me break it down. Your child at 3 4 months, ought to have started attending tracking. I'm going to break it down now to communication, social interaction, and behavior. So those are the milestones I'm going to be talking about, right? Your child ought to have started tracking. So if you have a 3 month old baby by that time, when you move your head, the child ought to track. There is also something called social smile. When you smile, your baby ought to smile back, And then there is another thing called queen, when the child just makes, those mouth sounds. And then there is also babbling. That's for speech, right? There is something called reciprocity, right? Or yeah, I mentioned the social smile. When you giggle, the child is going to laugh. When you smile, the baby is also going to laugh. Now, I'm starting from that very, the tender age. At a certain point, about 8 to 9 months, your baby ought to have started babbling. From 9 10 months, first word, even if it is dada, even if it is mama, your child also have started imitating, give me high five. Your child, then there is the crawling part, there is the walking part, there is the cognitive part. You understand what I mean? So
Yep.
when you are observing, when you're not seeing all of these milestones, of course, you should know that there is something missing. And then let me quickly go to the stereotypical and repetitive behavior. We know that that's another key factor for the autistic diagnosis. The stereotypical repetitive behavior, like the spinning, like the rocking, like the flapping, the peripheral side glance. And then there is this pattern routine where they prefer this certain routine, or whenever a routine is altered, there is a full-blown tantrum. It's just a lot. So what I would just say is, I've mentioned a few developmental milestones that you should look out for. That's whenever you're not seeing all of these milestones, you should actually speak to a professional, or yeah, speak to a professional, basically. Yeah.
Wonderful, absolutely wonderful. Communication, as you highlighted, social interaction from the behavioral perspective, and I like how you have particularly referenced very practical examples. The social smile you referenced is a common thing, right? Once I come across a child who is being carried by the mom, I tend to smile, and we tend to smile or make a kind of facial expression and expect their response. And I think what you have said, I think people would normally think that it's just that's what they do, right? I like how you have highlighted that this responses, reciprocity to actions from parents to these children is actually, these are milestones that they can check and ensure that the child is developing as adequately as neurotypical children, and recognizing when the need for diagnosis might occur. Now we get into yeah, right, as we're taking it one step at a time. Now there are early signs that have been noticed. For some people, these signs are not noticed early. For others, these signs are
Mm,
noticed, and some parents or caregivers are in denial. Right?
mm,
Let's now we have highlighted some signs to take note of. But in some cases, there's the version of the parents or caregivers that recognize these things and have the right amount of information, and they act upon it. They go for diagnosis. There are some that are in denial. They don't want to give it time. Let's give it time. And when it comes to neurodivergent conditions, there's the clear importance of early diagnosis cannot be overemphasized. So I want us to get into that for a bit.
yeah.
I want you to highlight extensively the importance of early diagnosis, and not just
Mm,
that, dangers of not diagnosing that child, that condition in that child early, so people
mm,
can see what is at stake and act accordingly. Basically,
mm. This is excuse me. This is another very beautiful question, and it's a question, it's a very sensitive one, as it were, because I mean parents are involved. And when I say parents, I mean daddy, mommy, the father and the mother, right? When it comes to awareness, like I always say, awareness is a journey, is a process. I will say that again for our audience to hear properly. Awareness, sorry, I beg your pardon. Acceptance, yeah, not awareness now. Acceptance is a process. Acceptance is not something that happens immediately for a parent. Is not. And you'll be shocked. The father might have gotten to this level. I'm trying to, describe something. Could you look here? Yeah. The father might be here on the cadre of, acceptance, and the mother might still be here. I don't know if you understand what I mean. So
Yep.
I usually, whenever parents reach out to me, I it's a very sensitive thing. And I encourage, okay, this is it. This is what you're looking at. Okay, you've observed this. Or you want to go for the diagnosis. Or you don't want to go for the diagnosis. It's fine if you don't want to go for the diagnosis because it's not easy. It's not an easy thing to do. It's not an easy thing to do at all. Some parents will say, I don't want my child to be labeled. But I'm of the mindset that if you don't want your child to be labeled, if you don't want your child to have a diagnosis, then other people will label your child for you. Right? Other people will label your child for you and give you different labels like stubborn, imbecile, different things, right? So it's just better off to do that. While I don't really push for it, I recommend it. I make them understand that it's a good thing to go for the assessment, have your child diagnosed. But if they don't want to go for it, it's fine. Why? Because it's really not easy for a parent to have, it's not really easy for them. And like I said earlier, there is the father and the mother thing, where how the father is here and the mother is here. There is chaos in the home. That's even another topic for another day, right? So it's okay if that's the process. But what I would say is this: don't leave your child in the house. You don't have to accept, but start something. There are different service providers out there. There are different therapy service providers out there. Like myself, I don't have to, like I always say, it is not the diagnosis that we're treating, it is the skill set deficit presented, right? It's not the diagnosis, it is the skills that we need to build that matters. So even if you've not accepted that, oh, my child has a diagnosis, or there's something wrong with my child is not meeting their developmental milestone and all of that, it's fine. But don't hide your child in the room or keep them in a mainstream school where they're struggling, right? Don't do that. Start something. Speak with a professional. Check for information online. Start early, start well. That's all that matters. Because like I said earlier, it's not about the diagnosis is important, but it's really not about that. It is about the skill deficit presented that we need to create goals on and work on. So when it comes to acceptance, I just recommend, but I really don't push because I've seen parents break down in front of me during consultations. I've seen them break down. I've seen them cry. There was, I hope I'm not taking so much time. There was a time
No,
I
you're not,
posted
madam.
something on my LinkedIn. Okay, there was a time I posted something on my LinkedIn and my LinkedIn and my Instagram. I said, people need to watch what they say. And it's just amazing how what you say to a mom or an autistic mom, I mean, a mom with an autistic child or a dad with an autistic child, that it makes them go back into their shell. I'll give you an instance. There was this client of mine who I went to the school for a meeting, and then it was closing time, and then the boy was, I think he was steaming, I think it was quite hyperactive, right? And then somebody said, control your child. What is wrong? Your child is spoiled. And the mother immediately started crying, and I had to just politely walk up to that person and I said, you don't say that. You don't know what is going on with this child. You don't know anything. So if you don't have anything positive to say, please and please and please, you could just keep your opinion to yourself. Those are the reasons why parents don't tend not to go for diagnosis. That's why they find it difficult to accept. Why? Because of what people will say. right? So when it comes to acceptance, it's a journey, it's a process, and I allow them go through that process, right? Without so much interference. I guide, I recommend, and then I step back and we work with their child. We build those skills as much as we can. Yes.
Beautiful, beautiful work you do, madam. It's important that you have said quite a number of very, very amazing things. I like how you said that it's about improving the skill. It was going to lead to a part of the conversation which I eventually was going to touch. There are people who recognize neurodivergent disorders and think that this is something that should be fixed or supernaturally remedied or something that will take drugs and but please extensively talk about how it's important to recognize that that there's these skills, the necessary skills, a neurodivergent person can improve the necessary skills that requires them to live adequate lives, and how you are employing that service you render.
Yeah. Excuse me. Yeah. So in ABA, there's something we call socially significant behavior, right? So, quick story, right? Behavior is anything an individual does that can be observed, that can be measured. So, what we're doing right now, what I'm doing right now, I'm speaking, I'm talking, it's a behavior. And then, head banging and hitting, steaming are also still behaviors, right? So, when it comes to the skills that needs to be built when it comes to the autistic individual to get them to that level of independence, there are so many skills, and it depends on the child. It depends on the child, and like I said, it actually depends on the skill deficits that the child has. There is a popular saying: when you meet one autistic child, you've met just one autistic child. They are all different, right?
Yep.
Why? Because of that level of support. A child might require substantial, according to the DSM-5, a child might require very substantial support, and all of that. And then another one might require just a little under the same communication, right? You might find a child who is autistic. Are you there? I think I lost you for a while.
No, can you hear me,
Okay.
madam?
Okay, yeah, I can hear
Okay,
you now. So
go ahead.
you might find, yeah, you might have a child who does well with, communication. The child is able to express themselves, but they find it difficult, to transition. And then you might find another child who transitions well, doesn't have so much routines, and then the child, is struggling with communication. So they are all different. So when it comes to teaching the skills, right, we meet the child wherever they are at, because they are all different and they have different skill sets, they have different skill deficits, right? So, and how do we do that? We kickstart with the skill assessment. We look out for their challenges in communication. We look out for their challenges in social interaction, and then there is the behavioral part of it. Okay. So after we are done with that, we come up with goals, right? That cater for the skill deficits. So if the child is struggling in the aspect of speech, or the child, because there's a difference between speech and communication. So if a child is struggling with communicating, interacting, we coin out goals to treat or to build that area. If a child is struggling with social interaction, we also come up with goals in that area. And then there is the behavioral aspect of it. The child has tantrums or severe steams. We come up with, excuse me, I beg your pardon. If a child is struggling with, behaviors regarding self-injurious behaviors or fecal digging or tantrums, as it were, of course, we bring in behavioral intervention strategies in place after data has been collected, right? So now you said something. You said, can autism? You said autism being treated, or being treated,
Yeah,
and then they become
how-
typical, right?
yeah. I was saying
Right.
how people really want to misdiagnose and just expect that there's a magical pill that you just take and transforms the child from neurodivergent to neurotypical.
Neurotypical. There is no, yeah. Excuse me. Oh wow, yeah. I see that a lot in the field. A lot in the field. People think therapy is magic. People think that there's one pill out there, the magic pill that the child will take, or there's one even diets. Gluten free, casein free. You do this to your child, give your child quinoa and all of those things, and the child. Well, I'm going to speak from data, right? Autism is a neurodevelopmental disorder, and it is lifelong. That's not to say that they cannot thrive. And that's not to say that they cannot be independent in certain areas. They can live life to the fullest, right? They can. Most of them can, depending on a lot of factors that we might go into later. But there is no magic anywhere. Therapy is a process. There is no magic anywhere. You want to start intervention and you want your child to start talking in less than 3 weeks or 2 months or 3 months. It's not done. So what I would say is let's just trust the process. Trust the process. Take it one step, at a time, and we'll see where that will lead to. Yeah.
Absolutely, absolutely. Trust the process, one step at a time, and with every milestone conquered, you see with patience, you get to see these things, recognizing the work that has been put in place to ensure that the child in question maximizes the best out of their lives. We're about 40 minutes in, madam. I just wanted to take out a minute to ask our audience. If you have questions for Madam Peace, please do well to send them in. We'll curate them and ask her at the end of the conversation. So it's not just only my questions that you're going to be taking. If there are questions from our audience or platforms, please direct them, and I'll be dealing with them before we round off for today. Madam, we have I've thoroughly enjoyed the conversation so far. We have highlighted the importance of early diagnosis. I want us to get into a little bit of evidence-based strategies, because we said it in the topic, right? So we're talking about managing, not just understanding. We've done a lot. The conversation has extensively highlighted the understanding part of neurodivergent disorders. Let's get into the managing part, right? Can you share with us some evidence-based strategies in which can be put in place to help manage people who are living with neurodivergent conditions? These are practices that caregivers can implement. Maybe people in church can implement. Just first-hand evidence-based strategies that can be implemented if I am surrounded. If, for example, I find myself in an environment with people living with neurodivergent conditions.
Okay, beautiful. So I would say a few things before I dive into the behavioral aspect of it. So generally speaking, when you meet someone with autism, excuse me, pardon me, please.
That's fine, madam.
Some kindness. Be kind, right? Just be kind. Be kind in your words. Be kind with your facial expression, right? Be kind in the aspect of, body language. You don't need to give that Nigerian, what kind of nonsense kind of child is this? You don't need to give that look. You don't have to, right? So be kind as much as if you're in church and then there is a mom and then there is a child, the mom and the child is autistic, the child is having a hard time, show your support, right? Was there anything I can do for you? Just be kind as much as possible. That's one thing I would say. Another thing I would say again is most autistic individuals have issues with communication. They have social interaction deficit, and then there is the aspect of behavior. So generally speaking, you are in a gathering, maybe the church, and then there is an autistic child in the church, right? Struggling, having a meltdown or a hard time, or the child is trying to communicate and the words are not coming in and all of that. That's another time to also be kind, be patient, look around for maybe someone who is familiar, maybe the parents of the mom of the child, the dad of the child, or the mom of the child, and just look for how you can help that child, and then just support as much as you can. So that's also generally speaking. The first thing I said is be kind, your facial expression, don't be rude, don't say anything negative, be supportive, because that parent is already having a hard time, and then the child is having a hard time as well. So now let's go to the behavioral, aspect of it, right? So how can we support autistic individuals with their behaviors? Now, when it comes to behaviors, we know that the very common behaviors or challenging behaviors as far as autism is is concerned is, of course, we have the tantrum, there is the severe steams, there is the self-injurious behavior, there is the aggression towards others, there is property destruction, and so on and so forth. The first thing from the behavior or the ABA aspect is we want to know the why. Why is this child behaving in this way? Why is this child having this meltdown? What's going on? What's that need? Could it be because there's a gap in communication? That's what I see a lot in the field. A child is, hitting their head. It could be because the child is trying to communicate some behaviors. Behavior is communication, as it were, right? When a child is head banging, or the child is teaming, or the child is, throwing a tantrum, excuse me, the child is trying to express something. So when it comes to ABA, as an ABA analyst, it's our job to get the why. Why is this child acting this way? And then, of course, there are 4 functions of behavior. If you need more information on that, of course, please feel free to, we could organize another program regarding that. But I'll just gloss through it. There's the sensory, there is the escape, there is the attention, there is the tangible. So when we know the why the child is exhibiting this behavior, we would now exactly look out for or put in behavioral intervention, strategies in place. But I'll give you a few instances. Sensory modifications. We all know that most children on the spectrum have issues with, sensory processing and all of that. So sensory modifications, if you have a child who is autistic and then the child is aversive to loud noise and you're in a public place, the noise canceller is going to work well, for that child. Or, get the child out of that area to a quiet place, whatever the case may be. The noise canceller is fine. I also encourage parents, especially the ones who have the capability to do so, to get the trampolines. You could have a sensory room in your house, trampoline, the sensory ball, so that when the child has that sensory need to know or is seeking such sensory input, the child is able to go out there and jump and get that need sorted out. Of course, there is communication. I mentioned something earlier that makes a lot of sense. I said behavior is communication. If you can teach that child an alternative way to communicate, you see a reduction in that challenging behavior. When you teach communication, you boost communication. In ABA, we call it functional communication. So when you build functional communication, you see a drastic reduction in, challenging behavior. Of course, other behavioral intervention plans will also be put in place, but functional communication works. If Benga is throwing a tantrum because he wants access to maybe the playground, why don't you teach the child to properly or socially significantly request the playground? If the child is vocal, excuse me, if the child is vocal, if the child is able to talk, you teach the child how to request that he or she wants to use the playground or go outside. If the child is not vocal, of course, there are other ways to teach, to help a child learn to communicate. There's gestural, there is sign language, there is PECS, there is AAC, as it were. So we could bring that in as well. Another strategy that works again when it comes to managing behavior or challenging behavior is priming. Priming means preparing the child ahead of time for that unpleasant situation that is to come, or prepare the situation is pleasant or not. Still prepare the child ahead. I'll give you an example. We have a child who, displays certain challenging behaviors when the child is not prepared. So in other news, the child is having issues with transitioning, moving from one activity to the other, or moving from one place to the other. Give priming. Prime the child. Okay, in the next 2 minutes, the next 1 hour, we're going to the library. In the next hour, we're going downstairs. Or in the next hour, you're going to go to bed. That kind of thing. That's in situations like that. So prepare the child ahead, give them information, give them prior knowledge, and then, of course, you'll see a reduction in that. There's another strategy that works again as a wrap-up, visual schedule. A lot of autistic individuals are visual learners. When they see information in maybe pictures, as it were, they get regulated and they're able to move through. So visual schedule is simply, highlighting the activities for the day, maybe in a picture form or in a textual form, depending on the level of the child. After this, you're done with this, you go to this, you do this. It all helps the child to transition smoothly. And lastly, as I wrap up, and I hope parents can hear me, acknowledge the good of your child. I'll say that again. Acknowledge the good things your child does. You'll be shocked, epic, that most parents, and I'll speak for myself too. I had to sit back and tell myself the truth. Most of the times, right, we tend to scold or reprimand our children or our clients more than we reinforce them. Why are you doing that? Move away from there. Don't do that again. Da, 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 da. But what about the times that they do what they're supposed to do? Do you say, oh, wow, you did that. I love that you did that the way you did. That's a good one. So let's strike the balance. And I will assure you, if you tilt more towards acknowledging their good, the good side, whenever they do anything positive, they do what they're supposed to do, they complete their task, they go to bed on time, just acknowledge that they have done something well, reinforce them, as against always reprimanding them. So I think that's all I have to say for now because of our time.
But those were absolutely beautiful. You have, I mean, I knew that I was going to be schooled, but I mean, I didn't expect this amount of knowledge that I have consumed because this is practical, evidence-based strategies. The priming reference was such a brilliant idea. Preparing the child, and we see this. We sometimes you see this and we don't understand how important it is, but with the way neurodivergent children are very particular about routines, the importance of priming cannot be overemphasized. When you say to a child, "We're doing this in the next 1 hour, so when we get here, this is what you should do. This is how you should interact with people. You're probably going to go in," and that was very beautifully said, Madam. You have more than blown my mind away with this absolute examples that you have given. As you've said, we've addressed our timing, so we try and extensively cover as much as we want to cover, recognizing that we do not have all the time in the world. So we're going to get into the importance of therapy, right? Because a lot of times people who cannot afford it might say, okay, I can't enroll my child in this. But sometimes people who can afford it would say, no, they will skip the stage in the child's life where therapy is paramount, all right? And enrolling the child in a center and just say, push them to mainstream school and all that. Let's highlight the importance, the role of therapy now, behavioral, occupational, speech and language, the role and the importance of therapy in the life of a neurodivergent child, in the formation of a neurodivergent child's life, and why it should not be, what's the word now, substituted for any other thing.
Yeah, that's a beautiful question. So I'll start by saying that there's a difference between early intervention and the right intervention. Right. Let me buttress that some more before I move forward. You see, parents say, "But I started therapy on time." Immediately, I observed all of these delays in my child's developmental milestone. I went for assessment. Oh, my child was diagnosed, and immediately we started therapy. I'm not going to. Sometimes they mention the name of the center or the therapy provider, but I'm not going to do that right now. And the child started therapy at, let's say, 23 months. That's close to 2 years. And the child is 5. No tangible progress, no tangible results, right? So what I would say is this. There's a difference between early intervention and the right intervention or the right support. So when you're starting early, ensure that you're starting with the right support. And what are the features of the right support or right therapy? The right therapy is evidence-based. The right therapy is goal-driven. The right therapy or the right intervention is there's a last one, goal-driven, and then there is progress. There is always progress. No matter how infinitesimal it is, there is always progress, right? So it is goal-driven. You cannot just be having sessions and when you say, okay, what are you working on? What have you been working on for 3 months? The therapy provider is not even able to, provide the goals or provide the progress notes or even have reviews, meetings with the parents I was speaking to a parent one time, and then the mother said, I've not had any meetings since I started intervention for like 3 years now. And I was shocked. Even parents are to be blamed sometimes. And sometimes I still don't blame them because they don't know what the right
Better.
therapy entails. So that's why we're having this conversation.
Yep.
Excuse me. Right? That's why we're having this conversation. So the right therapy is goal driven, evidence based, and there must be progress. Meetings at interval, feedbacks, right? It's important that you know what's going on regarding that. So now, speaking about therapy, I think I lost my thoughts flow. Please, you were talking. You talked about the
No.
importance of early
Yes.
intervention, right?
Role of therapy and the role of
Uh-huh,
therapy in managing
uh-huh.
conditions.
Okay, beautiful. So therapy is very important because if the child can meet their developmental milestone, if it is easy for them to, apologies, can you hear me?
Yeah, we can hear you now. We lost you for a bit, but we can hear you now, madam. Please go ahead.
Right. So if a child can talk, they would have started talking by now. If a child can interact, they will have started interacting by now. So that's where therapy comes in because it's obvious that your child needs that extra support. Your child needs that extra time. Your child needs that one-on-one intervention where goals are designed and then the goals are broken down, and they are taught those important or socially significant skills little by little, little by little. So it's obvious. So now you just have to, go for intervention. You have no choice. And like you already mentioned, there are different types of support out there. There is a speech therapy, there is ABA, that's where we come in, there is occupational, excuse me, there is physio, there are different types out there. And I think there is also electroacupuncture, there is stomatis, there are different types of interventions out there, but it depends on the needs of your child. Depends on the need of your child. So there are times where the child just requires occupational therapy, and there are times where the child just requires ABA, therapy because of that, deficit in communication and all of that. There are also times where the child requires core speech because of maybe they have the speech sound disorder or anything that has to do with fluency and whatnot, right? So collaboration, teamwork, everybody coming together to work as a team is what matters. So nothing can take the place of that one-on-one intervention. Medical support, very important. Your nutrients is very important. Of course, there are certain things your autistic child shouldn't take. There are certain things even a neurodivergent child should not take. Sugar is not so good, noodles for a child below 2, even there are a lot of things that a child of certain age should not be taking, and it goes for the neurodivergent as well. So look out for the nutrients. There is a nutrient part of it, the food, the diet. There is medication as well, but therapy is also important because that child needs that one-on-one support where skills are broken down, are analyzed, and then to bring the child up to speed. Yeah.
Absolutely, absolutely, I mean, absolutely well said. Absolutely beautiful. We have, I think we're about an hour into the conversation, and I'm not even ready to move an inch. I've thoroughly enjoyed every inch of what you have, how you have addressed the conversation. We're going to talk about. Let's get into a little bit of the mainstream environment, right? Now we understand to a fine extent neurodivergent disorders, and we are still in the process of extensively discussing managing it properly. Um, Institutions like schools, primarily, have a big role to play, especially for parents who used to enroll their children in centers. And you know how parents are. A lot of parents are like, at what point will they transition to mainstream schools? We get, at what point will my child move from the center to mainstream school? And that, for some parents, that's just the goal, right? And we have these conversations regularly. For other parents, it's not even a thing of will go through the center phase. They don't even want to enroll their child in the center. They just want mainstream, and they want to force and force and force the child to navigate this, even if sometimes it might be inconveniencing to the child. But let's highlight the role mainstream schools have to play in recommending recommending the need for a therapist, or recommending the need for a child to be enrolled first in a center, and not just that, but also accommodating a child who has been brought from a center to the school. Right? Let's talk about what roles do you think the institutions, schools have to play to ensure that a child who has made progress in a center and has now transitioned right to a mainstream school does not regress and fail on progress, and what can these schools put in place to ensure the ease of transitioning for that child, and ensure that the growth of that child is maximized to its best bits.
Yeah, beautiful one. So I'll start by saying that there are some children, we have a category of children who would benefit more from the centers. I'm a mobile therapy provider, right? I run a mobile therapy provider organization, and I'm not going to lie. I know that there are some children that will benefit more in the centers, right? Those are the ones with the severe, challenges. They require very substantial support. And then the mainstream school, no matter how inclusive they say they are, will not be able to support them in any way. So the center is better off for children like that. Children who require, very substantial support in the area of communication, very substantial support in the area of social interaction, very substantial support in the area of behavior as well. So the center is fine. And then whenever parents are trying to, force this down the throats of so many, mainstream schools, I love the fact that some mainstream schools who are not money driven are actually beginning to speak up and say, no, you know what, your child is not going to benefit it. We are not capable enough to cater for the needs of your child at this time. We don't have the technical know-how to cater for the needs of your child. So your child is going to benefit more in the center. So that's fine. That's good. Let them go to the center, and all their needs will be catered for there. And when they're ready, of course, the center is going to communicate to the parent that, oh, okay, your child has gotten to this level. We can now transition to an inclusive mainstream school, right? So for parents who are forcing it down the throat of, mainstream school, and my child needs to be in this mainstream school, please, schools need to speak up and say, please take your child to the center. Your child will benefit more from the center. And what happens is, parents like that, parents who fall into this category, when they do this, when they take their child to the mainstream school and then their child is struggling, they stay there for a while. They just stay there for a while, mostly because of the social outlook. What will people say? My child needs to put on uniform. My child needs to carry his school bag. My child needs to hold his lunch bag. My child needs to go to the mainstream school. It's mostly because of the social outlook. What people will say, I just need to join my friends. It's just really about the social outlook, not really about the child. So this is me saying that, parent, please, your child needs some very substantial support. The center is fine. So now when it comes to the mainstream school, unfortunately, here in Lagos, I'll speak for Lagos. Unfortunately, there are so many mainstream schools, I'm not going to mention names, who tag themselves as inclusive but are not inclusive. They just create space, table and chair for the child. It's as simple as that. Because I know this so much because I'm a mobile therapy provider, and I work with children in schools, in the classroom setting. So I see these things with my own eyes, right? So fine, the child is going to cope in the mainstream school, but the child just needs a little bit of accommodation when it comes to, the classroom setting, pull out sessions, or even down to the subject the child is going to take. Streamlining it down to simplifying the topics. I'll give you an instance. An autistic child who hasn't gotten to a certain level has no business learning, what's it called now? Is it social studies now that has to do with culture? I have a client that would say Igbo is a man, Yoruba is a woman, Hausa is a girl. These concepts are very abstract. right? So when in the mainstream school, it's very important that accommodation is there. You know, accommodation is there, simplification is there, modification is there. Just a few days ago, I put something up on my LinkedIn. I said I was speaking to two head of schools where I was pleading with them to please modify the exam questions for our clients. You know, just a little bit of modification, you know, here and there would help the child, you know, benefit or write that exam. And then there was a lot of back and forth. And then at the end of the day, they were able to modify, of course, with our help. We put in some pictures for the multiple option questions, put in some pictures, and then the child is able to, relate. So whenever schools say they're inclusive, they should be inclusive to the core. They should be inclusive to the core. A standard therapy room, a sensory room, of course. And then, the teachers should also be trained sort of so that they are able to, work with the child in class and work hand in hand with the therapist assigned to that child. And I believe that everything just has to do with all hands being on deck. It's a supportive, it's a collaboration, as it were. Are you there?
Can you hear me? Oh, okay. I thought we
Yeah,
lost
yeah,
you,
I
but
can.
can you
Yeah,
hear me now?
I can.
Okay.
Yes, I can hear you now.
Yes. Okay. You wrapped up with saying everything has to be a collaboration. Everybody has to play a significant role. I think that's where I stopped hearing you. That's the last thing you said, madam.
Yes, yes, yes,
Okay.
yes.
Absolutely brilliant. I like how you have referenced simplifying these things for this particular children who occupy the spaces, something as paramount as an exam, right? And how you just referenced that you had to, go at the school to ensure that these exam questions make it a little bit simpler, more communicative or relatable to the neurodivergent child who might be your client by adding pictures, and that's a very salient strategy that institutions can actually implement. For neurodivergent children in your midst, just more descriptive exam questions that will help. If it's that will help, that could also serve as a picture exchange communication system for the child to be able to interpret and answer the question accurately. Madam, you've spent quite some time in this space, and I'm sure firsthand you sound you speak. Everybody here recognizes that you sound like somebody who has had a lot of experience in this space. I want you to narrate to us um, a personal, real-time story that probably shaped your perspective of people living with neurodivergent conditions. If you have any one that is personal and particular to you, that you can share with us, obviously, considering all forms of legal permissions are granted. Yes. But yes, if you have any, please would appreciate a person real-time story that changed your perspective significantly or influenced your perspective significantly about people living with neurodivergent conditions.
Yeah. People often wonder, they say, Peace, you're so passionate about what you do. Do you have a child who is neurodivergent? And then I say, no, I don't have any child who is neurodivergent. It's just pure passion. So let me take you back to when I was in primary one. I shared this same story when I was invited as a guest at TBC a few months ago, right? I said, when I was in primary one, I think I was 6 then. There was this boy in my class. We used to call him Tolu Bam Bam. Tolu Bam Bam, wherever you are today, God bless you. So I remember very well, the name of our teacher back then was Auntie Love. I love that so much. So this boy back then, of course, we're in primary one, that was years back, the awareness, information that we have right now, we didn't have back then. And I'm very sure that even those teachers in that school were not trained as at that time. So there was this boy, Tolu Bam Bam, chubby, but I knew there was something wrong with him. And how? He was very slow. It was different. He didn't have any friends. He was not communicating. Whenever I would talk, he would say stuff like, I want. It was just, I was little then, so I didn't even know what was going on with him. But I knew that he was different. I knew he was special. But I liked him. So Auntie Love did something that made a lot of sense. She said, she put me beside him, where I was his body. We call it body system in AB. I was his body. So she paired me with him, and then She asked me to support him for my entire stay in primary one. I'll sit beside him. I will teach him. I'll dictate notes. So imagine there is a note the teacher writes, maybe a story about maybe Bible study now, a story about Samson, about five paragraphs on the board. Guess what? I will dictate the notes letter by letter by letter by letter. I don't know if you understand what I'm saying. That's the height of
Yep.
patience. As a 6-year-old girl, I'll dictate the notes letter by letter. So, for instance, if the note starts with Samson is a boy, I'll dictate S, you write S. A, you write A. M, you write like that. We're done. And I was doing that every day, and I didn't know why. I didn't know why as at that time. But I knew there was something wrong with him, and I helped him. I didn't know that I was being prepared for a moment like this in my life,
Absolutely.
because I have learned so much patience because of these children, right? There is nothing anybody can do to me at this point in time that I've been beaten before. I've been slapped before by a child. My strand of hair, was it braids now? The long one. He beat it out with his teeth. He beat a chunk of my hair. I screamed out that day. I screamed out. Oh my goodness. He beat it out. So what else can you do to me again? I've also been beaten on my back. This scar was there for like months. I
Wow.
turned to pick up something from the shelf, and before I knew it, on my back, I shouted. I've been hit on my chest before. My hair has been pulled out. I've been pinched and all of those things, but I'm still here. So what I would say is that's my story, and I'll keep sharing that story about Tolu Bambam, because I mean there is nothing else to say. It just has to be Tolu Bambam, and I just feel like, sorry that I'm bringing in the God factor. I was placed here for a reason, and God actually prepared me from primary one because of Tolu Bambam. Tolu Bambam, God bless you wherever you are. So yeah, that's that's my story.
Absolutely well said. I love this rendition because it was inspired by the now very famous Tolu Bam Bam in the Legend. But it's a beautiful journey you have had. Finding passion in this phase from as far back as when you were so young in primary one and keeping at it this long. I mean, indeed, you have weathered so many storms firsthand. Your interactions with children that you have worked with. Imagine having your hair being pulled off by the tooth. That's wow, my man. It highlights your unquestionable amount of resilience that you possess, and for that reason, we want to doff our hats and say, "Well done, well done, well done." A few questions before we still wrap up, so we'll just get back into the conversation. Now we've spoken extensively, highlighting neurodivergent conditions, understanding them extensively, and managing them. That's because currently operates from the same geographical location, which is Nigeria, which is the same space. Let's highlight a little. Let's highlight some ways the government can come in to help ease this process of experiencing life for people living with neurodivergent conditions. How can policies be implemented that help amplify the livelihoods of people living with, and not just amplify livelihoods, but also protect the livelihoods of people living with neurodivergent conditions?
Yeah, beautiful question you've got there. You know, I had the opportunity to speak at a webinar. I think it was April during the Autism Awareness Month, and then we were talking about what the government can do, the role of the government, and then people were talking about how that the government should provide, funds, build free centers like the public schools, right? Let's have a public center, or let's have various public centers out there. A lot was said. But then I remember that one of the speakers mentioned something. She said, the government is busy fighting terrorism in the nation. The government has a lot, that
On a
they are
plate.
currently doing right now. So we're not going to wait for the government. Definitely. What can we do? Right? I've said that, but let's put that aside. really, what can the government do? How can they come in? What I can see here is mostly policies. The last time I checked, the only policy we have when it comes to modifications and all of that, if I'm not, I hope I'm correct. I think that's for those the albinos, right? I think that's the only policy that I've not seen any policy regarding autism,
Autism.
right, or other neurodevelopmental disorders. It's mostly for the visually impaired, the ones who need the ones on the wheelchair, the physically, impaired and all of that. But there is nothing about neurodivergence, autism, because of course this one's in quotes, pardon me, they show for face, right? So you're going to see an autistic child and you wouldn't even know that there is anything wrong with him. But what I would say is perhaps the government can look into policies, check the policy again. I'm not a lawyer. What I just know is, one-on-one intervention and all of that. But I feel strongly that if the government can look into policies, modification, put policies in place, make it mandatory for schools to have maybe a sensory room, or make it mandatory for schools to train their teachers, on how to, accommodate neurodivergent children with autism, for instance, or other neurodivergent conditions in the classroom. Just put policies in place. I might not know a lot about policies and all of that, but what I know is once the policies are put in place, I want to believe that things can get better a little bit. So I would not say the government should open private or public centers and all of that. What can we do as individuals? And I want to commend you, Epic. You're already doing something. You know that, right? We're doing something. As little as this webinar, this panel discussion, as little as posting something on your social media about autism, as little as holding the hand of an autistic mom, of a mom with a child with autism, or a dad with a child with autism who is confused, as little or as infinitesimal as holding their hand and encouraging them and letting them know that there is light at the end of the tunnel, and autism is not a death sentence. It's something. So everything starts with us. The government has their role to play and all of that. We all know. But it starts with us. The kindness, the awareness, the acceptance in the school setting, the modifications put in place in the church setting, even in the mosque, even in the malls, in the supermarkets. Understanding, really, really important. So I think that's just all I can say. For now regarding what needs to be done.
Yes, absolutely. And I completely agree. The government has to, especially policy wise, we need policies that protect people living with neurodivergent conditions. And you have beautifully addressed that. I appreciate the recognition. It's not just myself. There's a whole team behind putting these conversations together. So yes, to the rest of the team at the K Foundation for Autism, Madam Peace has literally just eulogized us. So drum rolls wherever you are. We have some questions which I'll be addressing. I will bring into your foray in a bit, but let's. I think we cannot address neurodevelopmental conditions without highlighting the important role the family unit plays in the life of he or she who is neurodivergent, right? So I think the role of the family, even for neurotypical children, is very important. The family is responsible for creating the environment in which these persons can thrive, right? How can families adopt? Because from the get-go, you said with dealing with parents is always different because the father might be here with acceptance, the mother might be far apart. Now, it's beyond the father and mother. They are siblings in this case. They're cousins, they're distant relatives. So everybody has a role to play in helping the neurodivergent individual thrive. How can families amplify their environments and their living spaces to accommodate? This is from the home setting, to accommodate people, the sibling, the child, the cousin who's neurodivergent, and not just accommodate, to help build the confidence and protect even in public when necessary. Let's highlight the role of families in this, in ensuring
Yeah.
that he or she who is neurodivergent live adequate lives too.
Yes, the family setting is really important and cannot be emphasized, right? So one thing I will say again, I will start by saying this because this is what I see a lot in the field, right? Do try as much as possible to not hoard your child, right? Don't hide your child don't hide your child's diagnosis or whatever is wrong with your child or whatever is happening or whatever the case may be. Because you would need your family support. You would need your siblings, you would need the uncles, the aunties, you would need grandma, you need grandpa, right? Because it's the family. So ensure that I will say something. There was a client we were working with, and when I went for assessment, it was as if I was assessing the entire family because grandma was on the call, grandpa was there, about 5 of the mother's siblings were on that call. And then of course they asked for permission. Can we record and all of that? We're on a video. I said, please go ahead. They were all on the screen. Oh, so this is the therapy. She's doing this now. Oh, well done, well done. All right, this is what we're going to do now. They were all on board, all of them. And I said something to the mother. I said, you're very lucky. You're very lucky that you have such support system. Because if one of the fears that parents have is when I'm no more, what happens to my child? It is your siblings that will cater for your children. It is the uncles, the aunties, the sibling of, your other children that will be there to fill in the gap when you're there, when you're no more. So if you keep hoarding them, if you keep hiding them, then what happens? What are you expecting? So the first thing is don't hide the autistic child from your siblings. Don't hide if you have other older children, call them for a meeting. Okay, you can see your brother now. Of course, your brother does not act the way you do. There is something different about your brother. Your brother's brain is wired differently, and that's why he has challenges with this. That's why he has challenges with that. That's why you need to support him in school whenever mommy is not there, whenever bringing it down to their level. The family, really, really important, right? So what are other strategies that the family can put together? I mentioned it when I was talking about working on challenging behaviors in the home setting, and then I talked about how that whenever the child does what is good, reinforce them, acknowledge them, don't always do the same thing in the home setting. Tell mommy, tell daddy, tell the siblings, or be on the lookout for your brother whenever he does something good. Don't wait for him to do something negative before you scold him. Acknowledge the good things he does. That's another way. That's another way. And speaking about the home setting modifications, some parents might not be able to afford a sensory room or sensory modifications here and there. But the little that you can do, please do. Even if it means that depending on the needs of your child, anyways, depending on the sensory needs of your child, I can't really pinpoint anyone right now. And that's why you might need to speak to, a behavior analyst or a specialist in that regard. But really, just make sure the home is warm. And one last thing before I wrap up. I'm not an advocate or I'm not big on using aversive strategies. I don't believe in, making spanking the first thing your go-to strategy. You don't have to, beat your autistic child. I mean, they are struggling. They're struggling. You don't have to, beat. There are other strategies that you can use, of course. There are a lot of other strategies you can use. You don't have to slap them. You don't have to beat them. You don't have to be aggressive. You have to use aversive strategies on your autistic child. Be warm, be loving. That's what causes them to open up. That's what causes them to open up.
Absolutely. Well said, madam. That's what causes them to open up. The importance of compassion and highlighting or trying to reach their emotional side. The results and the impact of that cannot be overemphasized. We have a question from one of our guests, one of our listeners. I'll take that now because it's directed to you. So the question says, the speaker mentioned that you mentioned functional assessment. So in terms of contextual analysis, when parents have identified the source or the event that is eliciting the behavior from the child, but in an environment like ours, especially with the economic constraint, what are easy step-by-step ways parents can implement to make sure the environment of the home is contributing positively in the overall therapy of a child. I think this was asked earlier, but I think we've addressed it while we were talking. But please just go ahead. The question is, what are easy step-by-step ways parents can implement in the environment at home to contribute positively in the overall therapy of a child?
Yeah. So, well, I would not be able to give you that step by step because I don't know the child. I've not met the child, and we've not organized or done any functional assessments and all of that, right? So, what I would say is it depends on the needs of your child. Look out for the needs of your child. So, like you said when parents have identified the source of the behavior, that's the function of the behavior, and then when they've analyzed the function of the behavior. But I want to suggest that you do this with the support of a behavior analyst, right, or an ABA service provider, only if you're trained, because there are actually proper ways to go about it. So, I really do not know how to, but I guess I can just gloss about around it. And I'll go back to the strategies that I've given. Be on the lookout for, anything that your child does positively. You reinforce the child, acknowledge the good things that the child does, ensure that the home is warm, the home is welcoming, the home is filled with love. If you're able to put in environmental modifications in place, depending on the sensory needs of the child, you do so. I've also talked about strategies like priming, the visual support, the visual schedule. It all depends on the needs of the child. Functional communication, proactive strategies, everything depends on the needs of the child that I don't have tangible information about, right? So you might want to speak with a behavior, analyst, so that they are able to, do the proper, they have the steps that they carry out to arrive at a conclusion.
Beautiful, madam. I mean, like, I'm more emphasis just to add to what you said, the importance of why she's particular about seeing a therapist to without she's particular about not commenting because she doesn't have full awareness of the child, is because she has said earlier, early intervention is not always the right intervention. Right, so right intervention is always more important. So, and to get the right intervention, we have to fully know that all these things that she has mentioned have been adequately evaluated. Thank you so much, madam. We're going to be wrapping up in a few minutes. I want you to just give us a little insight on the work you do at Product Care extensively, because you said the mobile, you offer mobile therapy services. Let's highlight that. Let's highlight some of the challenges experienced and how long you have done that, so people who are interested, can always reach out, because the wealth of knowledge that you have dished out, I'm sure people want to follow up, right? So let's give them platforms which they can reach that you guys do at Produce.
Yeah. So thank you for that, Epic. So a quick one, could you please take off the LinkedIn user? Could you take off the question off the screen?
Oh.
I can barely, yeah, thank you for that. Yeah. So great. Produce Care is a neuro-affirming mobile therapy provider here in Lagos. Mobile in the sense that we offer school-based supports, we offer school-based therapy, and then home-based therapy. So it means that we go into the school setting to work with your child in two ways. So what do we do in the school setting? We have the classroom support where we're in class with your child, ensuring that your child is being carried along, and most importantly, breaking down or modifying the topics, as it were, so that your child will have a full grasp of what's being taught. That's number one thing we do in the school setting. The second thing we do in the school setting is the pull-out session. So we pull the child out to the therapy room, of course, with the approval of the teacher and the school management. We get to work on our goals one-on-one to bring the child up to speed. Then we do the home-based therapy as well, where we go to your home, we work with your child in the therapy space that you have provided. Product Care is certified. Our core area is applied behavior analysis, right? It's a type of intervention that uses the principle of the theory of learning to bring about a meaningful change in behavior or to improve skills like communication skills, social interaction skills, as it were. So we offer ABA services. We also offer speech-related services in the aspect of speech sound disorders and Gestalt language processing as well. We also do a little bit of sensory modification depending on the sensory needs of the child, right? We do that as well. We train right? We train teachers, nannies, caregivers, parents, and as it were, we do that as well. So basically, that's who we are. In Produce Care, we're very passionate at what we do, right? We're very good at what we do, and we really love to work with children. We're not trying to change your child, we're just trying to improve their skills and make them more independent in the society. So yes.
Absolutely, absolutely. For the never in doubt. If you've listened for the past 9 minutes or 1 hour 30 minutes rather, you will not doubt the pathways you said. They're very good at what they do. Absolutely, absolutely concur to that. Madam, it has been a worthy conversation. I've thoroughly enjoyed it. We'll wrap up with final words if you have any final words to say, and wrap up final words, and also an admonition to a parent who just found out their child, whose child has just been diagnosed. Let's address. I want your final words as you wrap up by also encouraging a parent who has just found out that their child has just been diagnosed with autism.
Yes. Okay, so I'll start with what my words of admonition to a parent whose child has just been diagnosed. So take a deep breath. Take a deep breath. Take a deep breath. It's a process. It's a process, it's a journey, right? So take a deep breath. As long as you need that process to take, it's really up to you. So it's either you do something or don't do anything. Two ways: do something or don't do anything. So my advice is do something. No matter how infinitesimal it is, speak to that professional, speak to that the therapy service provider, start something as soon as you can, follow up. Don't get too overwhelmed. I know it's not easy, but follow up, as much as you can, step by step, one block on top of another. We begin to walk hand in hand to ensure that, process or progress is seen. That's what I can say to a mom or a dad whose child just got a diagnosis. And my final admonition is, let love thrive. Acceptance is a journey, awareness is also there. Acceptance is very important. Inclusion is like that's what we're craving for. We want to see that inclusion in the society, and in your own very little way, be as inclusive as you can. Yeah, thank you.
Wonderful, wonderfully said. Ladies and gentlemen, that was Madam Peace Festus, ABA Applied Behavioral Analyst and the founder of Produce Care. And it has been indeed an absolutely enlightening conversation. It's the Lend Your Voice 1000 Voices for Autism series, proudly brought to you by Ike Foundation for Autism. Ike Foundation for Autism is an organization or foundation that handles and deals with matters pertaining to people living people living with autism and other neurodivergent conditions. And we have been honored and absolutely thrilled to have this conversation with the amazing Madam Peace Festus. From narratives inspired by the legendary Tolu Bam Bam to practices that have been initiated by the amazing Miss Love, we have learned today the importance of being kind, in facial expressions and in words, being supportive to people on the spectrum, letting love lead. That is one of the most foundational ways to ensure that we are building an inclusive and accommodating society for people living with autism. Ladies and gentlemen, it has been an exciting conversation. My name is Epic. Until we catch you next time on the Lend Your Voice 1000 Voices for Autism series. Bye-bye from all of us at the K Foundation from Autism and Produce Care. Bye. Madam,
Bye.
thank you so much.
Thank you for having me.